We now have quorum.
Yay, Joe's like, yay.
All right. Sorry for the delay. I'm going to call the Richland County Community and Health Services Standing Committee to order. Today is April 2nd, 2026. Roll call, please, Miranda.
Miller. Here. Raymer.
Here.
Engel. Hendricks.
Here.
Perry.
Here.
McGuire. Ferris. Braithwaite.
Here.
Chicker. You have 5 for a quorum, ma'am.
Thank you. And we have verification of open meetings law compliance.
It has been correctly posted.
Thank you. Approval of agenda. We have a 10-point agenda, so I need a motion to approve that, please.
Move to approve.
Thank you.
Second.
Thank you. Okay, and the next one is approval of minutes from February 5th, 2026 meeting. Everybody have a chance to read that. If there's any deletions, corrections, additions, let me know. If not, we will approve them as written. Number 6, public comment. Anybody have anything that is not on the agenda they wish to bring up? Hearing none, we'll move on. Going to reports, and we're going to start out with public health presentation.
Hi, good morning. This is Brandy Anderson. For those online, I am the Richland County Local Health Officer and the Public Health Manager. And aligning with National Public Health Week, which is next week. And at our request, Joe Larson is here as our guest presenter from Wisconsin DHS with the Office of Policy and Practice Alignment, or OPA. And I will hand it off to Joe Larson to present about public health.
Good morning. Thank you for having me here. I appreciate the invitation, and I'm excited to be here with all of you. I was just saying, this is the favorite part of my job, is to be able to come out and meet with boards, meet with health department staff. So I'm just grateful to be here, even though the drive was a little sketchy this morning, but it was okay. So today I have a presentation for all of you. I'm going to run through it pretty quickly, just for your time. But if you have any questions throughout, feel free to stop me or wait till the end, whatever you're comfortable with. I'm happy to answer questions or clarify anything in the presentation. And also we'll rely on Brandy and staff here to answer any specific program questions if you have it throughout that. So again, my name is Joe Larson. I serve as the Southern Region Director in the Office of Policy and Practice Alignment within the Division of Health, Public Health in the Department of Health Services. So buried way in there, there's a lot of names to the office. In my role, I work directly with local and tribal health departments, various DPH agencies, very closely with health officers as well. So that's a lot of training and technical assistance and consultation is my role. Today, we'll talk through a few things as far as the agenda goes. I want to give just an introduction, brief introduction to Wisconsin Department of Health and the Division of Public Health. It's a very big agency, so help kind of make sense of a little bit. Quick Public Health 101, just the basics of public health and what we do. And then some roles and responsibilities. And this part is specific to the statutes and rules within the state and how they guide what you all do as a Board of Health and also the health department staff. So next slide here is just quickly, the Wisconsin Department of Health Services recently moved our headquarters office. It was at 1 West Wilson. Now we're in a new building, which is just a few blocks away. So this is the picture of the new building here. But our vision is everyone living their best life, and our mission is to protect and promote the health and safety of the people of Wisconsin. So you'll probably see a lot of similarities in local missions and visions around the state. We all are pretty close to alignment on these two things. The next slide is just very hard to see here, but this is the organization of the Department of Health Services. Very big, contains multiple offices, multiple divisions. So you see within there, we have our Division of Medicaid Services and Division of Quality Assurance, which you may be familiar with. They're the ones that work very closely with human services agencies and care facilities, or things like that. We have our Division of Public Health is one of those, which is where I sit. And then we have other offices that are more the administrative pieces there too. Another piece within DHS you'll see is we also have the facilities. These would be like our treatment and mental health facilities. So some people aren't aware that we, as the DHS, oversee those as well. So the next slide is just an overview of the regions throughout the state of Wisconsin. So in the Division of Public Health, we separate the state into these various regions. And each region has an assigned regional director, which is my role, and we also have staff that serve statewide. In the southern region, I serve those counties that you can see down there in the southwestern part of the state. There's 15 counties and one municipal health department that I represent and serve. Really, what my role is supporting those public health agencies and the partners within them and those that they work with, providing local assistance. I can do in-person assistance, virtual, anything like that. And really being a one-stop shop to really help navigate the big system that is the state, DHS, and the Division of Public Health. I am not the subject matter expert in all things public health and all things health, but my role is to kind of know who might be and who to connect with, because it's very, very difficult for any one person, health department staff, all the things that they have to do to know who to go to. And my job is to really help make sure that those connections can be made. In that, it's really a privilege to work with the health departments and health officers like Brandy. You know, they're really the local experts in the local public health authority. And I bring a statewide perspective and resources and can help with the general concepts of public health. The next slide, I like to share this actually is an outdated framework here, but I still like it, so I keep it in here. This is talking about what is public health. What are the things that create public health? The Institute of Medicine defines public health as what we do as a society to collectively assure the conditions in which all people can be healthy. So that's greater than just our access to healthcare, whether or not we can see a doctor, whether or not we can get medications when we're sick. There's so many factors that go into whether or not a person, a family, or a community can be healthy. And that is where public health really focuses and thinks about. When you look at those things, that the way that we think about health, healthcare is really only 20% of what goes into keeping people healthy and allowing them to live their best lives. If you look at this framework, things like whether or not we have employment, what our education is, community support and family and social supports are a major part of what keeps us healthy. There's also things like the physical environment, air quality, water quality, and then our behaviors impact those things. So what we do for diet and exercise and whether or not we use tobacco, things like that can all impact health. Public health likes to focus on assuring the conditions that people can be healthy in. So diet and exercise, for example, is one thing. But if we don't have access to recreational areas, safe spaces to be able to exercise, or access to food, public health thinks about those things and helps to develop coalitions and support and community areas to address those things to help people be healthy. The next slide is the social determinants of health, which is an aspect of that past framework there that we were just looking at. This just kind of talks a little bit about some of those factors that I was talking about: economic stability, our built environment, and how they impact health. All of these things are things that determine whether or not we can live our best healthy lives. The next slide, I told you I'd fly through these pretty quickly here to get to the things at the end, but this is the evolution of public health practice. This slide talks about where public health started and where we've been and where we're headed. So when a lot of people think about public health, they have traditionally thought about things like going out and giving immunizations, things like home visits, and those sorts of factors. A lot of that individual service and meeting with members of the community to help take care of them. And that is really where public health started. There was uneven access to healthcare, and there were a lot of gaps in services. So when we look at where public health started to where we're headed, Public Health 2.0, that was the next evolution of public health that started in the late 80s and 90s, where we started looking at public health as a system, a bunch of interrelated factors that really help to keep people healthy. That's where we started looking at those determinants of health. And public health programs started shifting a little bit. And that evolved into what is now Public Health 3.0, which is what public health is really looking at being. And that is a convener, trying to figure out who in the community has resources to assist and cover those gaps and to assure those conditions that people can be healthy. It's bringing together the experts and knowing that public health is limited in the resources that we have, the staff that we have. We always wish that we could have a lot more, and I know that we could do a lot more if we did have more resources. However, we know that those are limited, and so it's important to bring the right people together to generate that community buy-in, and public health is that convener in those spaces. And we're still evolving. Because we're in that space doesn't mean that the individual services have gone away. We still need to provide immunizations to people in the community. We still need to figure out what those unique community needs are, be out in the community learning, connecting, providing services. So those things haven't disappeared, but we need to be strategic as well about how we incorporate those things into the community services that we provide. So this is a graphic here that shows where we're headed. The next slide is talking about what the role of local health departments are. And this ties into that last slide, and where I was really going with that is local public health departments are the center of the public health system. They are the experts in those services and programs and the needs of the community and who the partners are. And they're responsible for the health and well-being of everybody who lives within the jurisdiction. That's a big role and a big responsibility and a very challenging one. They really are focused on prevention, protection, but also promotion. Promotion meaning making sure that people can be healthy. It is one thing to protect people from illness and injury. It's another to prevent those things from happening. But that piece that public health is also focused on is those conditions where people can thrive. Not necessarily being absent of illness and injury, but being able to enjoy life and to be as healthy as possible. It keeps us out of the doctor's office. Of course, for regular checkups, that's important, but keeps us out for those illnesses, those injuries, things like that. That's where the focus is. Next slide. So this is the foundational public health services model, and this is the current model that many health departments in our public health system focuses on. I'll explain just briefly what this is, but at the foundation of those blue boxes at the bottom, these are the capabilities that every health department, every public health agency is expected to be able to do. These are the things like assessment and surveillance. So figuring out what is happening in the community and assessing for needs, developing partnerships. So knowing who in the community can meet challenges and help to keep people healthy. Equity is making sure that those who are in greatest need of support and service have access to the things that they need to be healthy. Organizational competencies making sure that the health department staff and the people working with the health department have the resources, the training, the tools that they need to do that work. Policy development and support. One of the things that we know is upstream factors. These are the things that are preventing and promoting health through policies. What we have access to, the legislation, the laws, the local ordinances, those things all can really impact health. That's where I'll focus a little bit on your role as the Board of Health, because that's a major component on where you function and how you support the health department. Accountability and performance management, again, making sure that the health department is continuously improving and that we're achieving our outcomes that we are striving to do. Emergency preparedness and response. One thing that public health is really good at is imagining all of the potential disaster scenarios that could impact us. We're really good at planning for the disasters, the weather events, the zombie apocalypse, whatever it is. We're ready for it. So that's what we're always thinking about, and scaring ourselves in the process. And then communications is really important, which is making sure that the community is aware of what's going on, aware of what they need to know to be healthy, and sharing things up front. So these are those capabilities that every department, every health department, and every public health agency, state, national, local, has to be able to do to ensure that we can do these other pieces, these foundational areas, and these are the more traditional things that you think of with public health. Communicable disease control and prevention, chronic disease and injury prevention, environmental public health, looking at human health hazards, looking at safe and clean water and air quality, maternal, child, and family health, and then that access to and linkage with clinical care. One thing that public health strives to do is be a connector between healthcare and public health in the community. At the very top, I do want to point out, it's very small on there, but a very, very important piece is that community-specific services. So this model is the framework for every health department to do, but it also accounts for there's unique needs of every community. What you need in Richland County is going to be different than what they need in Dane County, or what they need in Bayfield, or name any place around the state. And you know these community-specific services by the way that you assess the community and your connections with the people within the community. So I want to point out that that's really important, and that is considered in this model of public health. So we can go. This is just a graphic that shows what we're talking about with health inequality. It just kind of shows the differences that we're looking at in public health and all healthcare and how to help people be healthy. So at the top there, that is, a general person. I'll throw myself in that category where I don't have a lot of chronic illnesses or injuries or things like that. It's pretty easy for me to go access healthcare and be healthy. I have transportation. I have healthcare. I have a good job, support a family. Easy for me to get to health. That second one could be somebody that has a disability or has to care for family members or is caring for parents or aging family members. They have some more access issues. They may have challenges with keeping track of appointments and getting to things like that. So need a little bit more support. And then at the bottom, again, is somebody that, again, may not have access in the community, may not have healthcare insurance. What barriers do they see? They may not be able to get transportation just to get food. So we need to think about all these factors when we're looking at how to support the community to be healthy. All right, so that was the overview, just the basics of public health and where we focus and what we like to do. Now I'm going to get into a little bit about the laws, the statutes and rules that guide our public health practice. So these are things that are written into the state laws that we have to do as public health and are important to know. So This administrative rule 140, this is the administrative rule that guides every local health department and describes exactly what services all are required to do. The authority of this and the purpose of this is from state statute. So these are the laws that are passed by governor and the legislature to direct our work. The administrative rules are what DHS as an agency helps to determine how we implement the statutes, those laws. So we really, in public health, at least in my role, focus on a certain set of state statutes when we're looking at these rules. It's chapters 250 through 255. I don't ask you to memorize or know all of these, but those are, if I were to talk about those, it's really looking at 250 is the health administration and supervision of public health. That's what DHS is supposed to do. 251 looks at what local health officials do. That describes what the health officer does. It describes what you as Board of Health members do in 251. And then 252 through 255 are looking at the communicable diseases, how we follow up and monitor and respond to those, maternal and child health, environmental health, and then chronic disease and injuries. We go to the next slide, and this is pulled from that DHS Rule 140. And this is the required services that all health departments need to do. So this is one that I think is really important for Board of Health members to know, because it is your role as a governing body to help ensure that public health is doing, and has the resources to do all of these required services. Every health department around the state, whether it's the smallest one, smallest municipal department to the biggest city, has to do these required services. And those you'll see match up really closely with that model that I showed before, that foundational public health services model. And there's a reason for that, that they are the important things that we need to track and monitor. So some things that I wanted to point out, you've seen all of these in those other slides. Health promotion is one that I've talked a little bit about. That policy and planning piece is really important. One that I want to point out at the bottom there, that number 9 is a unique one. And that is that every health department is required to provide a generalized public health nursing program, generalized public health nursing services. Public health nursing skills of assessment and planning are interwoven into all of these different services. So I want to point that out because that's a unique one in here and kind of a little bit different than some of the other models that you'll see. I can go to the next slide. This is just looking at health department levels. Wisconsin is very unique. We're the only state in the nation that has a level designation for their health departments. And these levels look at certain required services, but also competencies and qualifications of the staff of the department. So every health department has to do level 1 services. Those are the ones that I just showed. For level 2, there's the required services plus an increased focus on workforce development, strategic planning, performance management, and quality improvement. And then level 3 required services are all of those above. And then an addition of more formalized performance management systems. And then this expectation to be what's called a chief health strategist. I like to say community health strategist, that is convening and strategizing with community members to meet the needs of the community. Moving from level doesn't necessarily mean more services or more programs or anything like that. It also isn't looking necessarily at the quality of services that are provided. It's really the level of the degree of services that can be provided. So we have many health departments that are doing everything in level 3, but they may be a level 1 or level 2 health department. And that could be as simple as the qualifications of the staff that are in the department. So you need certain degree requirements and things like that as a health officer or as staff to move within these levels. So and Richland County is level 2 health department. The next slide, I'm just going to skip over this one here, but this is just showing one of the required things that health departments have to do. This community health assessment and improvement plan, which I'm sure you've all heard about and seen. So I'll skip that for now. I want to get into this public health authorities a little bit so you know where, when we look at those statutes and rules, who is responsible for each of those things. So the public health laws are really intended to keep people healthy. DHS, which is where I work, is the lead agency for that, so helping to maintain the health system. We also look at the human services system as well, not within the Division of Public Health, but DHS as a whole is looking at both of those. Local boards, that's you all are the policy making bodies. So you help the local health departments with those community policies, those ordinances, the recommendations and connections with what is needed at the local community, and then ensuring that the health department is meeting the requirements of statute and rule. And then the local health departments are responsible for carrying out those laws, working with all of these levels to do all of those things. And really, when we're looking at the health officer, the health directors, they're really the operations managers of what's happening within the community, within the health department. The next slide is looking at the functions of the health officer. So these are important to know. Again, what I want to reiterate with this one is the health officer's job is to really maintain the day-to-day operations of the health department and make sure that the department is complying with statute and rule. So ensuring that the programs are functioning and meeting those needs. Health departments also work to create and send an annual report, which is reviewed by DHS. They recommend the goals of the department through strategic planning and that community health improvement planning. And a lot of those is just knowing the needs of the community and connecting. They work with and develop budgets. So if they have a need, a community need, their role is to advocate and recommend for the resources to meet those needs. And then recommending policies to promote health and well-being to you as a board as well, and to the administration of the county or the jurisdiction. The next slide is, excuse me, Board of Health functions. So this is where all of your functions here, and that's really your job is to govern the local health department. That means, helping to assure that they have what they need to meet these level requirements. You can adopt regulations for your own board, for the community, as long as they are not less stringent than what is written into state statute rule. You must meet at least quarterly, which you all do. So you're meeting these functions as the board here. The next slide is continued functions of the board. One of the things that I want to point out here is this very first one, which is assessing public health needs and advocating for the provision of reasonable and necessary public health services. As community members, as representatives of the people that you serve, you have a unique perspective and a unique connection to the members of the community. And so one of the things that you can do and do really, really well as board members is listening for what's out there, what is bubbling up in the community, what are those needs, and bringing them back to this space, sharing with each other, sharing with the administration, sharing with the health department on what you're seeing, and then advocating for services or connections to meet those needs. Another piece is listening to the priorities of the department, listening to priorities of the county agencies, and sharing those out in the community as well, whether that's sharing community events. So for example, if we're having a community health fair or immunization events, letting people know in your community that are in need that those are happening, and advocating for people to be there and support as well. This developing policy and providing leadership is another important piece. So if you see a need in the community, an unmet need, you can recommend policies. You can help draft things and recommend them to the local governing agencies. You can advocate at a statewide level, position statements or resolutions, things like that. You have a lot of power and voice as members of the Board of Health and a lot of respect in the state. So if you see things that are in need that you want to advocate for, working with the administration and the health department to do those things is a really important role that you have. And then these last few, you do this in coordination with your county administrator, with the county board. And so some of these things are individual roles. Some boards of health actually do the employing and hiring of people like the health officer. Some have the county administrators do that, or executives. So some of these things are unique to your local jurisdiction. So the next slide is just some samples of things that you might be, ways that you can fulfill your roles as Board of Health members. So one is educating yourself on the community and the public health status. That's through looking at those community health assessments and improvement plans, knowing and reviewing statutes and rules. I don't expect you to memorize all of those things. I don't, and I look at them every day. So they're not the most fun reading, but knowing what is required in those earlier slides is really helpful. Participating in local events, if there's things that the health department, public health department is putting on in the community, if you're able to show up and support them, it's wonderful to see Board of Health members at those events and connecting people in the community to those. And that's, linking the work of the health department and public health agencies. You represent public health in the communities, and also looking at and supporting the decisions that the county makes, that the health department makes throughout the community. The last few slides here, as I'm winding down, are just a few resources that I want to share with all of you as kind of next steps, and after I'm gone today, things that you can look at and review if you'd like. But one that I like to show is the National Association of City and County Health Officials, or NACCHO as we call it, has this profile of local boards of health. This one was from 2015. I believe it's been updated since then, that you can look at various boards and what that looks like around the country. The next slide is when we talked about governance of public health. This is really what that looks like, and I talked about most of these through those other slides, so I won't dwell on these a little bit too much, but this is also in that NACCHO profile as well. The last slide here or the next one here, these are those resources that I was talking about. So next steps, if you want to go out to learn more about what your roles are, what you can do, where your authority is, or just general support. Wisconsin Counties Association is a wonderful resource for board members. The DHS regional office, which is where I work, I'm always happy to connect, answer questions, or connect to resources if you need those. The Wisconsin Association of Local Health Departments and Boards, or WALDAB, is a member organization that represents you all as Board of Health members and also health department staff. So that's one that Brandy regularly participates in those meetings at a regional and statewide level, along with I sit in on those meetings as well, not as a member, but as a support. And then the National Association of Local Boards of Health. This is your national organization representing Board of Health members. So my last slide, you don't have to look at my picture there. But this is my contact information if you ever want to reach out to me for any questions, support, anything like that. My email, my direct phone number, happy to speak with anybody. And that's it. Ran through that as quickly as I could. Normally it takes me an hour, so I flew through as quickly as I could. But open to any questions or anything like that if you have them.
Well, thank you, Mr. Larson, for coming in. It's a fantastic day out there. I live in a small township, not much money, but some. And we have not had water pass in 3 years. And I've been working with these people saying, I know we're just a little community here. Voters come in here, patrolmen use the services. But if anyone drank that water and got sick, we need to be ready for that. I find no interest in getting this well drilled and replaced. I started and got the chairman and I got, the first proposal was $12,000. Now it's 17. It just is climbing and climbing. Is there a law against doing nothing?
That's a really good question. I would say that the laws are set up to ensure that the water is safe. So there are resources available for testing water to make sure that there's nothing in there that could make people sick. And once those things are found, that's where there's a hazard and there's a requirement to act in those spaces. So I could connect you with resources if you'd like at the state with the environmental health program.
And if I may,
Go ahead.
I'm gonna speak up locally. We have had there was an EPA grant for the 3-county region, and our county zoning director has been involved, as well as our health department as far as promotion. We just learned of this and came on board. My understanding is there's been some well testing in our region, and that's being promoted. Is that accurate, Brandon? Yeah. So we may be able to get you some information about that to see if that area qualifies for that type of testing right now.
Oh, testing isn't our problem. We've done that.
I see.
It's been tested. Has never passed. And we haven't been using it. So what they brought in was water for drinking outside. The Colligans doing that. But when they wash dishes or whatever, they just use that water. And I just about can't stand to watch it.
Might be worth a follow-up conversation directly to our department to kind of maybe explore some of those needs. I would encourage you to call us. Maybe we can help
Okay.
you. At least help to figure out how to connect to the right resource.
I went to Governor Evers last year and his office called and said that we were they put us basically on the agenda or on what the legislator were gonna ask. They threw it out.
Oh my.
Again. So, my hopes are fading. And there's some money. I mean, I'd even put it with some of it, but I'm not paying $17,000 when they don't care. Or don't seem to. Okay, Brandy, you and I are gonna be friends.
I want to also, I'm sorry, I regret to say that I was nervous and I forgot to also introduce my public health staff who joined us here today. Behind me are Evan Ewing, who is one of our public health specialists. Next to him is Grace Jessam. She is our public health intern here for her semester. And then we have Brandon Alexander on the end, another public health specialist, who are all just very outstanding. I have the pleasure of managing and working with all of these fine people. And the one person that couldn't join us today is Betty Nye, and she is one of our contracted public health nurses. So we are a very small but mighty unit. Everybody has their lead focus areas and strengths, and they all do outstanding work. We all do a little bit of everything sometimes, being a small unit. But again, I have the pleasure of introducing my staff here behind me. So if you ever have any specific program questions, we'd be happy to talk to you about that.
I have I don't know if it's really a question, but this was great about physical health, but one of the big problems in Wisconsin is mental health. How do you interface? I'm sure there's a mental health agency in the state government. I hope there is. How do you interface with them? Because physical and mental. Go, so.
Yeah. So from a local level, I'm actually going to partially hand this off as well to one of our public health specialists. That's That was an area identified through one of the guiding documents listed was through our community health assessment and then the community health improvement plan. And I'm actually going to let Evan speak on that just a smidge, if you heard just a little bit here.
Yeah, so mental health was a priority area that was identified in the community health assessment, which is that survey that's done by members. So stigma was a causal factor that was identified for mental health. So that's sort of the negative perception around mental health that might deter people from accessing services or even just talking about mental health. And then access to services was the other causal factor. So a lot of our work that we do to implement the community health improvement plan is to address those causal factors. So we have a community health improvement plan mental health work group that meets monthly to try to tackle those issues. So we've done some community presentations to try to educate people on stigma, some community outreach for Mental Health Awareness Month. So last year we had done outreach to 72 businesses in Richland County to provide them with information on the observance, but also information on resources for their staff, trying to encourage them to provide their staff with an employee assistance program, would be sort of access to mental health through their workplace. So a lot of what we do is focus more on mental health promotion, I would say, versus like mental health treatment or that actual direct service. So I can just speak to that part of it. I'm not sure, I guess behavioral health would kind of tie more into that treatment aspect. But we're continuing to meet monthly and really working on those two causal factors, but we're also administering a community stress survey as well. So one of our data points that we track is poor mental health days, which is reported in the county health rankings and roadmaps data. And within our work group, it was identified that stress may be one of the factors that would lead somebody to report a poor mental health day. So we're trying to assess what the stressors are for community members and then be able to provide interventions to address those stressors with that part. So that's the work that we're focused on primarily in public health with that.
Great to hear that on a local level.
Yeah, thanks for the question.
I just want to say as a unit, strategically, and with having an intern here this semester, it's been really helpful. Our goal has been to, some of the things mentioned in that presentation by Joe were identified in our 140 review as some areas of opportunity. And having an intern here has helped us to examine our data a little closer and compile that a little bit more effectively into an updated annual report this year to highlight that. Also working on an internal strategic plan and how to more effectively meet our objectives, but then streamline those tasks within our own unit. So the other thing is she's been working on some community surveys which focus on immunizations and communicable disease and to assess knowledge of the community and where we can really focus our efforts. You know, everybody's aware that, measles is a kind of one of those things that we always worry about that's kind of lingering in the back of our head. But we just want to make sure that we understand what the community's knowledge is, if they know how to access services, where to go for their immunizations, and those kind of things. That's all I have.
Anyone else have anything? Any comments or questions? You're getting off lucky.
Appreciate that.
Yes.
Thank you for having me.
Oh, thank you for coming. Drive safe going back.
Thank you.
All right, reports, continuing. B, HHS Director, Administrative Report, please.
Right, so in the packet are my and the unit updates for the agency. Just a couple of things that are, I wanted to highlight, in the treatment court coordinator. The treatment court coordinator took some initiative, based on some recommendations, through that group, for, the treatment court individuals who have to do community service. They've adopted a highway, so, we are excited to have that be a thing out there, raise awareness about the program, and give those individuals an opportunity to help the community.
Roxanne, do you know which highway they adopted?
They adopted Out 14 towards, I think from Roan Road back this way, where they usually went 2 miles. It's out, and so where Roan Road is south on 14, so. And then back this way towards town, so, yep. So you see that sign out there, that's kind of exciting.
Yes.
See Richland County represented. I just wanted to do a shout out and thank the committee, and you can thank the county board as well. Last fall, I don't remember if you remember signing a resolution, approving a resolution that got submitted to the legislature to increase income maintenance funding, because we were going to be seeing some reductions from the federal match that we used to get. And so that got approved and got signed off on. So we should be able to be made whole on some of those things that they were, with some of that funding that they were going to take away from us. And that's in part due to you all signing off on that resolution. So thank you very much. And then homelessness in Richland County, Health and Human Services continues to be a part of that conversation. We've been attending some ending homelessness meetings. Hopefully down the road, we can have more discussion, or we are having more discussions on different topics as we come together, as far as like potential funding, capacity options, those kinds of things. So in the future, who knows if I might bring something to the board to get your blessing on. The ADRC, Roxanne updated us with information about the men's shed. They had their first men's shed a couple of weeks ago on March 11th, and that is something that's going to continue second Wednesday of the month every month at the Wood Community Center. Rise and Dine at the Phoenix Center is very popular. Third Friday of the month, we're doing breakfast. This last month in March, they had 64 attend. So that was like definitely exceeded expectations there. So it's very popular. They just completed their 5-year DOT audit for transportation and came through that in compliance. So that's exciting. And if you hear of some hiccups in transportation for some members, they're ending the contract with us and going with MTM. So we're kind of trying to work through that right now, getting that reset up and whatnot. So
Yeah,
that's a work in
struggles.
progress.
With that change.
Yeah.
And it's very impersonal, MTM or
MTM.
it's very impersonal. So
Yeah.
what we've experienced is we're supposed to call them. They don't give us any confirmations of when they're picking up. And then like, let's say a resident goes to an appointment, they're now required to call MTM for them to come pick them up. So they have no contact with the driver until they're in the vehicle. So
Yeah.
it's just very unfortunate.
So Roxanne's working very hard on trying to get that all figured out. She's got her hand raised, it looked like, so.
Well,
Yeah.
and then I understand too that, the contract is supposed to end March 31st.
It changed, the date
And,
changed.
and
right,
then
Roxanne?
got it extended for a couple of months.
Yeah, so the contract now is ending May 31st. So we are working through that process. Actually, the committee yesterday authorized for me to send an advocacy letter to Inclusa to see about them looking at different options instead of going only with MTM. Also maybe looking at doing a hybrid model where the ADRC can still provide those trips. And then we are also trying to work with MTM right now to be able to get a contract so that way we can continue to provide trips, because the ADRC just for Inclusa alone provided over 2,000 trips last year. So it really is something that will adversely affect a lot of people within our community. So we are trying very hard to get through that process.
Thanks, Roxanne. In behavioral health, they continue to do what they do, very busy with adult protective service cases, comprehensive community services cases, crisis, they're doing great work there. I know you mentioned about the mental health behavior. We do have the behavioral health unit over there. So as far as access to mental health services, we do have a vacant therapist position. So know of anybody out there looking to do some mental health therapy, have them give us a call so we can provide that. And child and youth services, they've had 72 reports so far this year, 11 of them screened in. Says that it's a little bit lower than other times of the year. But again, starting to see a little bit of a pickup there. And then just giving you a heads up that you should start seeing some, Eric's going to be doing the planning for the Summer Yes Youth Empowerment Services program. So he does some mentoring with kids, and in the summer they pick some special projects and they do some activities in the summer. So you should see that out there. Economic support, if you scroll down there. I've got managers getting creative with their reports. So, encouraging the creativity there. In economic support, they exceeded again in pretty much all areas what the benchmarks are set by the state and by the consortium. They're exceeding, our staff here locally are exceeding those benchmarks, so that's exciting to hear. We have an on-call worker that handled over the last 3 months. Looks like they're handling about 100 walk-ins and or phone calls a month. So busy with people asking for that economic support help. And then we have public health updates. If we scroll down there, Randy already touched base on a couple of them. Measles has not hit Richland County, so that's great. In here, you'll see when our next immunization clinic is going to be. Looks like they still have radon kits available. She introduced Grace, who's our intern. She's been writing their section of the 2025 annual report. Evan gave a CHIP update on what they're doing for the mental health and substance use activities there. So any questions about anything? It looks like I've got managers on, so otherwise I can answer.
Are you done with your?
I am done.
This MGM, I am not. Is this like a taxi service or what?
MTM is the transportation agency that is actually hired through they do all the Medicaid trips. So if you're on Medicaid, that's who you would call to get a trip through them. But Roxanne has her hand raised, so she can explain a little bit more about how that plays in with this whole new thing here.
Is it for
So they're not
county?
the whole, yeah, the whole
And so they
state.
just call in and they ask which way to come. Pick them up at a certain
Yeah,
time.
it's they're a statewide organization.
I think just for managed care Medicaid, because they still use the VO.
Yeah. Oh, they still use VAO for the other?
Yeah.
Okay.
So that's
I guess I thought MTM bought out VAO or something.
They did.
Oh, maybe I lost track.
Yeah, they did buy out VAO. So VAO is basically MTM. So actually it was the intent years ago for MTM to do all of that Medicaid transportation, except for the family care organizations, because it put such a strain on that system. But now over the last year or so, they've been looking at, MTM has been contracting or trying to contract with different family care organizations. So right now, there's only a couple of MTM drivers that come out to Richland County. So there is a lot of concern about how they're going to meet that need. We have heard stories of people that have reached out to us that just have straight Medicaid, wanting us to pick them up because MTM didn't show up to take them to an appointment or didn't show up to pick them up from an appointment and get them home. So there's a lot of concerns right now in the rural areas of the state. I think MTM works okay for your more populated areas. They have more drivers in those areas. I do know that I heard from Juneau County yesterday was day one of MTM starting to provide services in Juneau County, and they've already had 4 different issues over the last day and a half. So so we're hoping that we can get signed up with them where we can continue to provide that local service to our community members. But yeah, MTM is definitely, it's in all counties, but they don't have right now, they do not have the bandwidth to provide all the trips.
It's like a headache to me.
Hmm.
Question. At the city council meeting this week, that Monday night, there was a lengthy presentation about Lydia's house, talking about homelessness now, sorry. Have you any connection with that discussion or with that, facility?
I was not in that meeting, connection, but Roxanne is on. I know you're connected to Lydia's house, right, through the homeless coalition?
I am.
Do you have
So there's a long, yeah, I guess, I'm just wondering what your question is, or what would you like to know, and I can try to answer to the best of my knowledge.
Apparently, there's a funding issue. I just wondered how that fits with the county or if it does.
So right now, it does not, the county does not put any money towards Lydia's house, neither does the city. Lydia's house is funded from primarily the churches and private donations. So they have a budget of about $39,000 a year, and they provide services to individuals who are homeless within our community. We do have the requirement that it's a Richland County resident, so we don't bring people in from outside of the community to provide those services. Lydia's house right now, there's a temporary agreement right now with the house that we use for a child's place. There's just been some back and forth with that. It originally had been with ARC, Richland County ARC, years ago, and then went to Southwest Cap, and then Southwest Cap turned that over to the city. So we're right now in those discussions with the city for Lydia's house to continue to operate that shelter, which we've been doing since about 2012. So that conversation has been happening. There was a time frame where we were not able to house anybody there since like November. And so this process is just trying to get that figured out so that way Lydia's house can continue to provide homeless supports. Along with that, there is not any a lot of funding sources coming into that. So that's where those discussions with the homelessness prevention and working with individuals who are homeless, that's where those discussions came in from those meetings that were had here at Health and Human Services with the Balance Estate, who is where all the funding for homelessness comes from. That's where all those conversations, that's why we're having those conversations. We do the point in time count. The EDRC does that twice a year. We work with the Homeless Coalition and do a point in time count. And I think I've done now 22 of those because it's twice a year. And this year is the first time in the winter that I've found so many individuals who are living in their cars or they were in shelter because there was an emergency shelter opened. And so we had 11 individuals, and that, right now I would say there's probably 20 to 30 individuals who are homeless within the community that we are aware of. So it continues to be an increasing need. So try to pull all the stakeholders together to start just having some of those beginning conversations of how do we address this going into the future.
Very good. Thanks for that explanation.
Yeah.
Anyone else? Thanks, Roxanne.
I could also mention Rise and Dine. My wife and I happened into a local restaurant must have been on the third Friday for lunch. And there were a whole line of people who said, why weren't you at Rise and Dine? And we hadn't even heard.
Oh, well, now you know.
Well, I don't know what time.
So it is on that third Friday of the month. You just call the EDRC to sign up for that by the Monday before, and it goes from 8 a.m. to 10 a.m. So,
Okay.
Yeah, so just give us a call. We do have to have reservations by Monday because the last time we kept getting reservations, by Monday we had 27 reservations. By Wednesday we had 55 and then 64 came. So just to make sure that the Phoenix Center has enough food prepared, we need to have those reservations, if at all possible, by Monday before. So, but they can call anytime during the month before that to sign up. So feel free to give us a call and we'll get you signed up.
All right, thanks.
You're welcome.
I think that's all I.
Anyone else? All right. C, HHS expenditures report, vouchers and expenditures over 2,000, but less than 10.
Yeah. Some of these reports today are pretty tough to compete with visually, but I will work on stepping up my design game. So for the expenditure report, we had a total of 92 expenditures, which totaled just under $39,000. The numbers were a little boring, but that's what we like to see, right? So these reports include volunteer driver expenses, prepaid expenditures, and purchasing cart activity. With nothing being unusual, does anybody have any questions about the expenditure report? Okay.
Thank you.
Hearing none, may I move on to the budget summary for 17? Okay. So for the 2026 budget summary, as of the end of February, we're approximately 12% of the total budget utilized, which is in line with where we expect to be at this time of year. Most programs are trending appropriately. Just a few highlights. Administrative building and operating costs are slightly higher at around 26%, which is typical early in the year due to just front-loaded expenses. We also lost our water heater earlier this year, so those unexpected expenses can sometimes create that utilization to be higher. We also have CCS and birth to 3 lowering utilization, meaning they've spent less money than expected thus far. Overall, the budget is looking stable and is aligned with the expectation points for this part of the year. Is there any questions about that? All right, so for placements, we're seeing a difference between adult and children's costs so far this year. Adult placement costs were a bit higher earlier on, mainly due to a small number of higher cost placements. But again, there's not much that we can really control with that. Our children's placement costs are currently very low, which is great. We've had limited activity thus far this year. Overall, placement costs can fluctuate quite a bit month to month, just depending on individual needs. So we'll continue to monitor those activities closely.
Thank you. Any questions or comments? Pine Valley Community Village Administrative Reports.
Good morning. Census, we're averaging about 66. The goal is to get a little bit higher. We've had some, return to communities and deaths in the building. Several hospitalizations following, respiratory issues. We've had COVID, influenza, GI, and we're back to COVID, and we just had an influenza positive today. So
no.
It's like a vicious cycle right now. We have not had surveyors in the building this month. We did do a self-report literally the other day. It falls under the abuse and neglect. We are currently investigating to determine if intent is found. But so far, based off of the information that we have obtained, there is pretty good suspicion that intent was found. Quappy, we are currently working on our care plans and getting them a little bit more personalized and just kind of getting them more in line with the required changes that occurred in 2025. There were just some hiccups and duplicates and things that were in there that did need to be. We did implement those angel rounds that I talked about last month. For all the management staff, it has been going extremely well. Very little complaints, very, very little. Everybody seems very happy. They feel like they're being taken care of very well. They feel respected by the staff. So that I think has been helping quite a bit because, yes, the 31st, we had our resident council and I had no complaints. So I was excited about that. We did go to a staffing or a job fair the other day. Talked to quite a bit of nursing staff, talked to social workers that were like health and human services. So I gave them the information for HHS and then talked to a lot of the nursing staff. But it sounds like a lot of them are going to be testing for the LPNs, but they're going to remain in school to obtain their RN. So we did hand out some applications there. So we're expecting to get a few applications from that. We do have the Kickapoo High School job fair that they're having there, so we are signed up to attend that as well as the Riverdale job fair there. We are attending the senior living expo that they have every year, so we're already set up for that. I'm working with the sheriff's department, specifically Mike Siz. We are working on getting our active shooter policy in place. We are doing education with the staff as of the 13th and the 21st, and then planning the scheduled active shooter drill. Each year, we are required to do something emergency with the community. And last year it was our water. The year before that was a CPR thing, and this year we're going to do an active shooter. It's something that I haven't seen a policy on it, and nobody's actually ever done a drill. So I think it's important that we do one this year. Looking at roofing bids right now. So I had somebody out yesterday, had another person out the other day, and then we have one coming out Friday, just kind of take a look at our roof and getting those bids. ITSE, we are fully transitioned over there. And again, not many concerns with food. I actually had several residents seek me out to tell me how great things have been. So really excited about that. Technology, we are having the issues with the call light, and I did receive a bid, which was very, very small compared to what I was anticipating, just to simply do a firmware update, and we should have that communication resolved. And then again, like I said, lots of compliments on the food, no concerns with CARES when it came to resident council.
Are you done?
I am.
Can you tell me, the travel nurses are gone? You don't need travel nurses anymore?
No, it says on here that we still need nursing. We're still working on getting nurses.
Oh,
in
I
the
thought
building.
you had only 2 positions.
For CNAs, correct.
So you still have your travel nurses?
Correct. I don't know if that's gonna go away too soon. The biggest thing is we have a lot of shortages with nursing. And that's nationwide at this point. There's waiting lists to get into the nursing program at this time. We did put out the VA, Pat brought it to us, so we put it out for, scholarships and kind of talked to some of our nursing staff or LPNs or CNAs that want to. So that's been posted and available for staff, and hopefully we can help continued education.
Thank you.
Can you tell me the starting wage for a CNA?
I think it's 21 something. Let me look it up. I think it's 21.53 or 83.
That's close enough. That's.
Yeah. Yeah, we're well within line, and we just did the wage analysis, and we are reviewing the CNA wages this year or this upcoming year for their job review. So they're on that docket.
Brittany, don't forget that if you have a individual that has gone through their first year of nursing through school, that the veterans group, the 40 and 8, we do have nursing scholarships.
Yes, that's posted at our building.
Great.
So Pat Richland brought it in for us and said here, so that way if they want to apply, they can.
Right, and I did talk with Mr. Jim Hine. He is in charge of that program with our local group here. I asked him to drop off some applications for this case. So evidently he hasn't seen you yet, so I will see him hopefully tonight.
I don't know if he's seen Pat, because sometimes Pat volunteers and she'll sit up the front, so maybe, because we had the application.
Okay.
So
then
I'm wondering if
did
he just
bring
handed it off to her and then got it to me.
Okay, great. Anything else for Brittany? Anybody online have a question? Correspondence, do we have any? Nope. Okay, moving on. Anybody would like to see any future items on the agenda? No? Then I need a motion to adjourn.
Well, I can do that.
Okay. All in favor, please say aye. And all opposed? A good friend of mine always says, you may stay if you oppose. All right, thank you, everyone. Drive safe.
I have a quick question.
Yes, Vince.
When are we meeting?
Some big paragraphs.
Yes, it's always the first Thursday of the month. Well,
Oh, the time.
the time is gonna be questionable because we have new county
Yep, okay.
Oh,
board.